Hey everyone, this is Dr. Lake with Theophilus Health. Wanted to show you guys just an updated progress on one of our clients. We do periodic checks with our lab work to ensure that we are following the right process, that we are not missing anything, that we are making necessary tweaks. And just want to kind of show you guys some updates from this awesome client that we have. So if you kind of look here, you can see that when she came in, one of the things that we check a lot more than this typically, but this is just some of the labs that we wanted to check again. And as you can see here, her folate was very low when she came in. And folate, if you don't know, has a lot of different functions. But one of the particular functions that we noticed that she was having issues was detoxifying from things like hormones, creating energy, all that kind of stuff. And as you can see, her folate was quite low and it's moving up in the right direction now. That's kind of right where we want it to be for the most part. And so that's all looking good. As you can see here, her vitamin D level went from 30.2 to 35.6. This is a good improvement. Fat-soluble vitamins are going to be kind of going low and slow with those. So the fact that this was taken during the summertime and now this was taken during November, it's a sign that we probably need to increase that dose a little bit more. But it is moving in the right direction because vitamin D has a really critical roles in immune function, pain, just a lot of different things like that. And then also here you can see vitamin B12, again, super important for energy, super important for detoxification, methylation. You can see here she is up, moving in the right direction. We typically want people to be above 750, and she is definitely moving in that direction, and she's above that already. And so we're very happy with that result there. One of the other big things I want to show you here was just her inflammation. These are a couple panels that we retook again because they were high. And as you can see here, she was clinically elevated with her HSCRP, which is a generalized inflammatory marker, looking at basically just how inflamed you are across the board. And so as you can see, she was at 8.1, which is well above the high-risk range of 3.1. And now you can see here she's at 1.8, ironically enough, and making really great improvements. She should be down in the control range within probably the next 3 weeks. And as you can see here, homocysteine, again, this is an issue. If you're making homocysteine, it means that you're not making glutathione, which is a big antioxidant. And as you can see here, she is now in the control range, looking nice and in stable control. Something here we look at with insulin resistance. This is a thing called adiponectin. It's a protein that helps in metabolism of fat and some other substances. This is a sign that she's moving in the right direction, that her protein or her metabolism is increasing and that she's not becoming as insulin resistant as she was. So that's a fantastic sign there. We'll go down here to her hormones real quickly. This is the last thing I want to show you. One of the cool things that we did, she's a postmenopausal woman. When she first came in, she was having a lot of issues with sleep, with hot flashes, with a lot of hormonal imbalances. And as you can see now, this is the result of not using any hormone replacement therapy with progesterone. This is just strictly giving her some targeted supplements, tweaking her diet, getting her to sleep well, and reducing her inflammation is what really generated this awesome result with her progesterone. And also down here, just real quick, her pregnenolone, which is actually the precursor to forming things like progesterone, also went up, which is a good sign as well. So again, just wanted to show you these things to you. I think they're really awesome. I love showing off these kind of results because these have real world significance. And if she came in here and I'm hoping to get her to do a testimonial, but if she could come in, she would tell you not only does these labs just show progress, but she would also verbally demonstrate that she has seen significant progress in just her quality of life, not having pain in her joints, being able to be more active, sleeping better, and having better engagement with people that she's close to. And so that's really what it's all about. I hope this was enjoyable for you guys. If you're interested in doing something like this and working with us at Theophilus, we love taking on people that are struggling with chronic disease, people are having issues with excessive weight gain, hypothyroidism, people that have hormonal imbalances or diabetes, whatever the case may be. We want to help people get their life back and help them accomplish these kind of things because it is very possible for most of our clients. Thanks and have a blessed day.